Bismillah ar-Rahman ar-Rahim. I would like first to express my great thanks to my dear brother, Professor Mahsen al-Zalimi, and the organizing committee for inviting me to be a speaker in this scientific event. I will present today 10 cases, hoping that it will be interesting for you. The first case is 38-year-old female patient presented with 1 year history of breast lesion. On examination, starting first on the left breast, under surface of the left breast, then smaller one start to appear on the right one. On examination, patient looks healthy, she's well, she's obese with large pendulous breast. There is no lymphadenopathy. The lesion is bluish red reticulated, infiltrated lesion with many ulcers. One of them is larger than the others. She has been seen by many colleagues prescribing many medication without improvement. This is the lesion on the left breast. The following differential diagnosis had been considered. The first one is Paget disease of the breast, squamous cell carcinoma, chronic non-specific ulcer, and metastasis, in addition to the possibility of self-inducing skin lesion. I took a biopsy from her. The biopsy showed a diffuse proliferation of capillary vessels in the whole dermis, superficial and deep. And there is a dense proliferation of endothelial cells without spaces and without nuclear atopia. So histologically, in correlation with the clinical feature, this is the histological features. Many ectatic or uniformed blood vessels. There is no nuclear atopia. So the diagnosis of what is called diffuse dermal angiomatosis. It is a rare disease. It is said to occur mostly in patients with severe vascular disorders. 8 cases was reported worldwide. For the breast lesion, 2 cases were reported previously, and this is the 3rd case. It was submitted to the Indian Journal of Case Report for publication. It has been said that isotretinoin 40 milligram twice a day for the first month, then 20 milligram twice a day for the second month is effective. Really, I tried it, and the patient became better. But the main treatment, the main curative treatment, is to advise the patient to reduce the wet one and to do mammoplasty, to reduce the size of the breast. Because although the exact pathology is not well known, but it has been suggested that hypoxia induce trauma that enhance endothelial proliferation, resulting in this rare clinical condition. Now, the second one is a 15-year-old patient presented with generalized asymptomatic yellowish to yellowish-brown papule increasing in number to involve the whole body and extremities. You can see here multiple apule, yellowish brown, sometimes skin color. Differential diagnosis: eruptive xanthoma, histiocytosis, and eruptive syringoma. A biopsy was taken. It showed a list of eccrine duct with date ball-like structure embedded in fibrous stroma in the upper dermis. You can see clearly here multiple eccrine duct and the date ball as you see by the arrow. So the diagnosis is eruptive syringoma. Eruptive syringoma. It occurs mostly in young age group. Female predominate male, and it is said to be triggered by hair removal, shaving, hair removal, and some cases was reported following diffuse inflammatory skin condition or dermatitis by any means. The third case is a 20 years old male patient presented with painless, multiple flesh-colored masses at the back. Differential diagnosis that has been considered is neurofibromas and leiomyoma. This is the clinical picture. A biopsy was taken from one of these lesions showing interweaving smooth muscle fibers with a cigar-shaped nuclei and eosinophilic cytoplasm embedded between the collagen fibers. As you see here, the cigar-shaped nuclei and eosinophilic cytoplasm. So it is cutaneous leiomyoma. As you know, there are 3 types arising from smooth muscles of the erector pili muscle, and sometimes from the endothelial cells of the smooth muscle of the blood vessels and from the genitalia. Treatment is excision, particularly if it is single, in wide separate, in multiple, although surgical is advisable, but the recurrence rate is more than 50% of the cases. The next case is a 48-year female patient presented with 3 asymptomatic psoriasiform rash at the back. It was treated as a case of psoriasis. The improvement is not remarkable, and the recurrence is rapid. These are the skin lesions. Histopathology showed non-caseating typical dermal granuloma with multiple giant cells, so that it is a case of psoriasiform lupus vulgaris, which is unusual presentation of lupus vulgaris. X-ray was taken and it showed pulmonary TB. She was referred to the TB center. She received anti-tuberculous drug and all skin lesions disappeared during the course of the treatment. Psoriasiform lupus vulgaris. It is going to be published in the Indian Journal of Dermatology. Another case, 48-year-old female patient presenting with itchy erythematous scaly bloods on the scales, mainly at the border. The patient gave a history of seasonal variation affecting the trunk and the extremities for 20 years duration. This is the patient. This is the clinical presentation. You see here the characteristic scales, one following the other, what is called trailing scales. This is more clear. Some differential diagnoses were considered, like tinea, dermatophytosis, which is common in our country, as my colleagues said, but scrubbing is negative. Histopathology showing dense perivascular lymphocytic infiltrate around the blood vessels. Yes, you see here what is called coat sleeve lymphocytic infiltrate. So that this is a case of erythema annulari centrifugum. It is precipitated by many things, like it is a reactive skin lesion triggered by inflammatory skin disease, like, for example, tinea pedis, severely inflamed tinea pedis, hematological malignancy, endocrine disorders, pregnancy. The treatment of erythema annulari centrifugum is topical application of steroid and calcium inhibitors. The other one is 14 years old female patient presented with asymptomatic single smooth dark purple papules under the breast for 1 year's duration. This is the lesion. Kaposi sarcoma has been considered. Spis nevus is another differential diagnosis, but histopathologically it showed dilated vascular spaces in the superficial dermis with overlying epidermal hyperplasia, so that the diagnosis is, as you see here, spaces, vascular spaces, and epidermal hyperplasia, so that it is a case of angiokeratoma. The other one is 20-year-old female patient presented with this asymptomatic generalized reticulated maculopapular rash involving the trunk and the extremities for 4 years duration. It is not responding to all modalities of treatment given. See here, a papular lesion, here trans, or it assumes a reticulate pattern. Dorsum of the hand and the back is also affected. Differential diagnosis, subacute lupus erythematosus, PLC, and secondary Lewis as a great imitator. Histologically, as you see here, showing dermal, upper dermal lymphocytic infiltrate with epidermal tropism and haloepidermal cells. So the histological diagnosis is mycosis fungoides. It is not poikilodermatous, because as you know, poikiloderma is atrophied, hypopigmented skin lesion. Here, the skin is normal, of normal texture. Mycosis fungoides. Another case is 74-year-old female presented with generalized erythematous excoriated, intensely itchy papules associated with severe itching. She is diabetic, she has chronic renal failure, and she is on dialysis. Differential diagnosis, these are the lesions as you see. DH is a possible. Here, the papules are grouped, intensely excoriated because of severe itching. Scabies is another possibility. Atopic dermatitis and other differential diagnosis. Skin biopsy showed cellular debris with collagen fibers elimination through a cup-shaped superficial epidermal ulcer. So histological, see here, this is the cup shape, and these are the collagen fibers and the debris running from the upper dermis to the epidermis. So the diagnosis is perforating dermatosis. They said it is more common among patients with chronic renal failure, particularly those on dialysis. Treatment is the treatment of the underlying cause, definitely, and it has been said that steroid plus keratolytic agent like tretinoin is said to be effective.